Inside a house in Antigua, Guatemala, health workers spray for mosquitoes. A few doors away, a suspected case of Zika, dengue, or chikungunya was reported. But fumigation and inspecting homes for standing water where the mosquitoes that carry Zika breed isn't easy when people don't understand the importance of the work.
Sometimes people won't let us into their houses because of the level of insecurity in Guatemala. They're very reluctant to let us in. Community participation is low.
So far, 105 cases of Zika have been confirmed in Guatemala. But while countries like Colombia have stepped up their public awareness campaigns, Guatemala hasn't. In the public hospitals and health clinics that we visited, there were no leaflets or posters with information about Zika in sight. The health ministry told Al Jazeera they don't have the resources to pay for such printed materials. And it was only this week that a Zika alert appeared on the main page of the ministry's website. ARAGON says Guatemalans shouldn't have to depend on the media for guidance.
Here in the hospital there's no information. Also there are mayor's offices everywhere and they should hand out information and fumigate like they used to.
Hospital staff said they rely on patient visits to get the word out about Zika.
People who have symptoms can come to a health center. Without creating a panic or an exaggerated warning, medical staff can determine if it's a suspicious case and then rule out that it's not dengue fever or chikungunya.
Analysts worry that if the number of Zika cases were to reach levels seen in other Latin American countries, Guatemala would be unable to cope.
The health system isn't prepared to prevent this type of situation or to tackle Zika if it becomes pandemic. Corruption has clearly had an impact on government resources and its capacity to deal with these kinds of situations.
With people in more than half of Guatemala's 22 departments at risk from Zika, the danger is there. The question is how the government will respond if the threat becomes a reality. David Mercer, Al Jazeera, Guatemala.